Let's take a peek at healthcare reform and how Americans feel about a possible change in policy.
The American Medical Association may now work to oppose the so-called government option for healthcare.
June 10, 2009, Washington. As the healthcare debate heats up, the American Medical Association is letting Congress know that it will oppose creation of a government-sponsored insurance plan, which President Obama and many other Democrats see as an essential element of legislation to remake the healthcare system.
We welcome back Catherine Sirks. She's from the Association of American Physicians and Surgeons. I just want to reiterate here, we've got a New York Times report that the AMA now says it opposes any proposal for a government-run, government-led, government-managed insurance program.
If we have mandated insurance, it's the slippery slope towards whatever mechanism is used, whether it's a public plan or whatever.
Is there a turnaround in the medical community? Is there the beginnings of it? Look, we're not so sure we like this government program.
It's very ambitious what he's trying to accomplish, and I hope that we can move forward and can accomplish that. Certainly encouraged by his fact that want to have physicians at the table being part of this, making these decisions to go forward, because it's very important. The physicians are willing to and should have a seat at the table.
Section 123, Health Benefits Advisory Committee. A. Establishment. 1. In general, there is establishment of a private-public advisory committee which shall be a panel of medical and other experts to be known as the Health Benefits Advisory Committee to recommend covered benefits and essential, enhanced, and premium plans. A. 9 members who are not federal employees or officers and who are appointed by the President. 9 members who are not federal employees or officers and who are appointed by the Comptroller General of the United States in a manner similar to the manner in which the Comptroller General appoints members to the Medicare Payment Advisory Commission Act under Section 1805, subsection C of the Social Security Act. Such even number of members not to exceed 8 who are federal employees and officers as the President may appoint. Such initial appointment shall be made not later than 60 days after the date of the enactment of this Act. Public input. The Health Benefits Advisory Committee shall allow for public input as a part of developing recommendations under the subsection.
To be able to help craft it and go forward, because we're the ones that are out there working, and those that are in the trenches know what works well and what happens.
Would you rather have your doctor deciding your benefits and policy, or the CEOs of the insurance companies, like the AIG guys?
Let's make it clear. There's the medical community, and then there's the AMA.
The AMA is the largest doctors group in America.
Doctors are overwhelmingly, what we're hearing from doctors, that they're against it.
Actually, 66% of doctors are for it. Most doctors, particularly family doctors, favor health care reform that includes both a public and private option, a New England Journal of Medicine survey found, September 15, 2009.
They are not well represented by the AMA. Has been losing members
as well.
I think we're on this road together. I think that was really the message that I took from this, that it wasn't just that he had a plan and that he was going full steam ahead, but that we all have a role to play, that this is going to be a collaborative relationship.
And the bottom line is, as long as it's all about the money with the AMA, it's going to come out of somebody's pocket or be rationed care for patients. So
Actually, no. If insurance companies dictate, as they have for so long, you'll pay far more and receive far less care. Plus, insurance corporations will decide if you have a pre-existing condition and deny you coverage.
Bottom line, as long as the AMA's squealing like a little stuck pig about money, patients are going to pay the price.
Actually, as long as the Republicans favor the insurance corporations over American citizens, the citizens will pay the price.
If indeed doctors are coming together to oppose this proposed government insurance plan,
endorsement by the AMA speeds the way for the President to accomplish one of his signature campaign promises, July 16, 2009.
Have you got the clout to beat it back and defeat it?
You know what? It's not about whether the doctors have the clout. It's whether their millions and millions of patients have the clout.
73% of Americans are for our president's health care reform plan.
Many Democrats outside of the Obama, Pelosi, Reid, Waxman cabal know that voters won't stand for these kinds of foolish prescriptions for our health care or for ourselves.
Michael Steele uses a government-provided health care plan for he and his family.
Candidate Obama promised change. President Obama is conducting an experiment.
And Michael Steele is lying.
He's conducting a dangerous experiment with our health care and with the quality of our lives.
Perhaps Michael Steele should give up his government-provided insurance plan.
He's conducting a reckless experiment with our economy.
That was the GOP and Bush administration that collapsed our economy.
And he's conducting an unnecessary experiment with our tax dollars. Experiments that will transform the very way of life of our country and its citizens.
You will pay less for health care. 73% of personal bankruptcies are caused by medical care costs.
The president is rushing this experiment through Congress so fast, so soon,
since it's so vital for our economy,
that we haven't had a moment to think if it would work, or worse, to think about the consequences to our nation, our economy, and our families if it doesn't work.
Is Michael Steele saying he's dropping his government-run health care coverage? Of course he's not. It provides him the best possible care. America's largest and most powerful doctors group has endorsed Barack Obama's massive overhaul of the U.S. health care system, removing a substantial hurdle to legislation that Democrats hope will extend health care coverage to most of the estimated 46 million Americans who currently lack it.
President Obama isn't trying to control exorbitant medical bills. He wants to control the entire U.S. healthcare system. Having seniors submit to end-of-life counseling every 5 years isn't something talk radio made up to scare people. It's in the bill. It should scare people. President Obama himself, not talk radio, inspired fear of rationing when he suggested that instead of needed surgery, vibrant seniors should take pain pills. And in fact, rationing is in the bill too, since everyone will be affected except the Democrats writing the legislation. There's good reason to fear. For 50 years, there was no threat to seniors. Democrats ran scare the seniors campaigns every election cycle. Republicans going to take away their Social Security. Now with a genuine threat, liberal journalists carry Obama's water. Thank goodness seniors are learning what's actually in this bill so they don't have to rely on drive-by state-controlled sellout journalists who ration the facts and the truth without even batting an eye.
The survey of 2,130 U.S. doctors published in the New England Journal of Medicine also found that more than 55%, regardless of their medical specialty, would favor expanding Medicare so it covered people aged 55 and older. Health Policy Center, overall assessment. Our general assessment of the Obama plan is that it would greatly increase health insurance coverage, but would still leave about 6% of the non-elderly population uninsured, compared to 17% today. Substantially increase access to affordable and adequate coverage for those with the highest health care needs, including those with chronic illnesses, by spreading health care risk broadly. Significantly increase the affordability of care for low-income individuals, and reduce the growth in health spending through a broad array of strategies.
No matter how we reform health care, we will keep this promise to the American people. If you like your doctor, you will be able to keep your doctor, period. If you like your health care plan, you will be able to keep your health care plan. Period. No one will take it away, no matter what. My view is that health care reform should be guided by a simple principle: fix what's broken and build on what works. And that's what we intend to do. If we do that, we can build a health care system that allows you to be physicians instead of administrators and accountants, A system that gives Americans the best care at the lowest cost. A system that eases up the pressure on businesses and unleashes the promise of our economy, creating hundreds of thousands of jobs, making take-home wages thousands of dollars higher, and growing our economy by tens of billions of dollars more every year. That's how we'll stop spending tax dollars to prop up an unsustainable system and start investing those dollars in innovations and advances that will make our healthcare system and our economy stronger. That's what we can do with this opportunity.